Hi, everyone. Thanks for joining the call today. My name is Brenda Bryan with Viridian Health Management, and I'm going to be moderating today's call. I do want to let everybody know that the call today will be recorded, and it will be posted to the NHWP website, so it'll be available there as well afterwards. We do have everybody on mute, just so that we have good audio during the webinar. If you have a question during the presentation, you can type it into the question feature on the right-hand side of your screen, and we will be monitoring those questions, and we'll be able to open up the lines at the end of the presentation for Q&A. We'll read out those questions if we have some that come in during the presentation, and you can also use your raise your hand, and we will unmute you during the Q&A as well if you'd rather ask your question. So again, thanks for joining the call. We appreciate everyone taking time out of your day to be on this webinar. The webinar today is Evidence-Based Worksite Health Assessment for Effective Health Improvement Plans. Today's presenters are Brenda Schmidt, who is CEO of Viridian Health Management, and Jason Lang, who is Team Lead for Workplace Health Program, Division of Population Health with the Centers for Disease Control and Prevention. So let me just take a moment to introduce both of our presenters, and then I will turn it over to Jason, who will get us started today for our presentation. Jason Lang is, as I mentioned, Team Lead, Workplace Health Programs, Division of Population Health with CDC. In his role at CDC, Jason has managed projects and provided leadership for the CDC National Center for Chronic Disease Prevention Workplace Health Initiative since 2007. Jason is also the CDC project lead for the National Healthy Worksite Program, which is a 2-year demonstration of a comprehensive workplace health program for small to mid-sized employers, of which Viridian is a contractor for this program on as well. Jason is a graduate of the 1998 Public Health Prevention Service Program, a CDC postgraduate fellowship, of which he worked at CDC headquarters as well as in the field. Jason was assigned to the Maryland Department of Health and Mental Hygiene program in Baltimore, and he was there from 1999 to 2001. While he was there, he helped establish Maryland's comprehensive cancer and tobacco control programs, as well as organizing a statewide physical activity coalition. Jason has an MPH as well as an MS degree from the University of Michigan in Ann Arbor. And let me introduce to you as well Brenda Schmidt, who's our other presenter today. Brenda is president of Viridian and CEO of Viridian Health Management. Brenda is a widely recognized authority on integrative healthcare services and programs that deliver positive health outcomes and financial results. Brenda is a frequent speaker nationally on strategies to implement and evaluate effective population health management programs. She serves on a number of different committees, including the NIOSH Total Worker Health Expert Panel. She has a leadership role in the Clinton Global Health Initiative. She is a member of the Health Enhancement Research Organization, or HERO think tank. She is also a member, a new member of the Care Continuum Alliance Board of Directors as well. Brenda Schmidt holds a Master's of Science in Immunology from the University of Wisconsin, as well as an MBA from Arizona State University. So I'm going to go ahead and turn it over to Jason now to begin the presentation. Again, you can use the question feature to type in questions, and we'll monitor those and queue those up during Q&A, and we'll open up questions at the end of the presentation.
Thanks, Brenda. Good morning, good afternoon, wherever you're tuning in today for our presentation on the National Healthy Worksite Program assessment tools. The focus of our presentation today is going to be on the release of the organizational and individual employee level assessments that we are using in the National Healthy Worksite Program, and we'll get to that in a moment. But prior, just want to provide for everyone on the phone a brief overview of the National Healthy Worksite Program for those who are unfamiliar with it, as well as kind of our data collection and assessment approach and some strategies and tips for data collection and assessment that you might be doing in your own organization, or you might be working with other employers to help support, whether you are using the National Healthy Worksite Program tools or others that are currently available. So Brenda Schmidt and I will break up the presentation today, and then as Brenda Bryan said, we will open it up for questions at the end. The National Healthy Worksite Program is a national demonstration that we began in the fall of 2011 that involves 100 principally small and mid-sized employers, both coming from the private sector and the public sector in various communities around the country in order to build comprehensive workplace health programs in those organizations that address high-risk conditions and employer cost drivers, principally with a focus on physical inactivity, diet and nutrition, and tobacco use cessation. So we have several overarching goals that support that, principally being the reduction amongst the workforce of their risk for chronic diseases, promoting sustainable and replicable workplace health activities, and then creating a number of different forums and opportunities to link participating employers to local resources or organizations that have an expertise or capacity in workplace health so that participants can learn from others as well as sustain their activities over time. We have a number of outcomes of interest in the National Healthy Worksite Program, all again built around these establishing comprehensive workplace health programs, whether it is putting in individual level behavior change interventions or addressing the broader organization and working environment through policies or environmental supports. We want to, in the end, build both employee level and employer level knowledge, skills, and awareness of healthy lifestyle practices and change the overall work environment to be more inclusive of a culture of health promotion. The National Healthy Worksite Program is really driven by on-site support for the different developmental stages that any organization would go through in building, establishing, or enhancing a workplace wellness program. So whether it is assessment and data collection, which will be the focus of our presentation today, or latter stages of development, whether it's planning, implementation, or evaluation, all of those things in the NHWP are being supported and facilitated by staff that we have embedded in the different communities where our participating employers reside to help support and advance those activities. These are our communities. We currently have 8 of them. Sprinkled around the country. They were selected because they were high need, but also geographically diverse. They have a mixture of different employer sectors and workforce demographics, and they also had a capacity that we assessed prior to selecting them, where, again, we could create opportunities to link participants with local level resources. So we initially selected 104 employers this past summer in June and are currently working with a group of 100 of them. Again, mostly small and mid-sized employers. So you see from this graph with the size distribution that almost 9 out of 10 of the employers we have participating in the program have less than 250 employees, and over half of them, I think 52%, have 100 or less employees. So we're really dealing with relatively small employers that come from all kinds of different backgrounds and industry sectors. You can see on this slide what some of the major industry sectors that are represented within the program are. We did some lumping here so as not to report every individual sector. So those that you see representing other or other services would include groups that represent agriculture or construction or transportation or education. So I think with the exception of mining, we began the program with every major industry sector represented by at least one employer, and some of the governmental organizations or manufacturing or healthcare and social assistance represent a fairly good number of our overall population. The National Healthy Worksite Program is using a comprehensive approach to assist employers in building their programs. And by what we mean by that is that we are selecting interventions and strategies that are geared toward intervening at both the individual employee level as well as higher levels of the organization or the organization as a whole. Comprehensive approach also includes opportunities to address multiple health risks and conditions concurrently. So when we're talking about physical activity, we're coupling that with nutrition and directing it toward either reduction of the risk in diabetes or to address weight management and obesity. We're talking about obesity in the same vein as we're talking about health and safety. So making connections between different risks and health conditions. And lastly, we mean a comprehensive approach in terms of the mixture of interventions and strategies that are applied in building their programs. So not purely educational strategies, not purely policy or environmental support strategies, not focusing only on the benefit package and nothing else, but looking at opportunities to bring all of those things together to look at and intervene with the high-risk areas or cost drivers that employers have. Now, this comprehensive approach is, as you can see on the last bullet, not very common amongst employers who report offering a health promotion program in the workplace, and it's even less common when you get to the small and mid-sized employer group that really is the focus of the NHWP population. So that comprehensive approach is kind of represented in the bubbles that you see on the top line and the middle line and the bottom line. Again, mixtures of different types of interventions, mixtures of different levels of the organization, the employee level or all the way out to the community level. And we marry that design approach with three basic developmental stages. An assessment phase that tries to look at what's going on in the organization, what are the needs, what are the employee interests, what are cost drivers, determining what will be done about those needs and interests through a planning and implementation process, and then trying to determine at the end what impact that this had, good, bad, or indifferent, by going through an evaluation process. We have done both local level training on this framework and model, as well as national level training through these webinars, which is represented on this slide, the different kind of courses that we've offered over the last year and a half. The training included core concepts and principles related to this model and framework, the evidence base for key strategies and interventions, and then trying to move employers toward action by providing tools and resources to aid them in putting those evidence-based and science-based strategies and interventions into practice. At the end of the presentation, we'll show you where to find all these resources, so I'll hold on that for a minute. But you can view our past trainings as well as get not only the assessment tools today, but other tools and resources working on for the last couple of years. When we were recruiting employers for the National Healthy Worksite Program, we had in mind several evaluations and assessment areas that we were going to focus on, and really became how we were developing the assessment tools. So as I mentioned with some of the program outcomes of interest, looking at changes in knowledge, behavior, and health risks. At the individual level, we're looking at changes in health and safety culture or productivity at the organizational level, and distilling all of that information and experience down into models or tools or resources for other employers is something very much that we have been doing and will continue to do throughout the remainder of the program. Also during the recruitment process, many employers told us that one of the key reasons they were interested in participating was the ability to have access to a robust set of data. And so we really stressed the assessment phase and developmental step as something very critical to the overall program design and program plan that we're using in the National Healthy Worksite Program. Many employers, and particularly those responsible for managing wellness programs in their work sites, often want to jump right into the real fun stuff, which is what programs and activities and events that they're going to be holding to get people excited and engaged and participating in their own health and wellness. And we want to do that as much as anybody, but again, really want to stress that the process of going through and trying to understand what health issues are present in the workforce or the workplace, why they might be issues, and how the organization wants to track change and track, hopefully, improvements over time is something that really can't be an afterthought, but something that you should do up front to really set yourself up for success over time. So that makes this assessment process in general something key for us to have available. The assessment process also helps make connections between different types of health risks, individual health risks and the environment, and can answer a number of key questions about what's going on, what people want to see happen, and for those things that have happened, what's the outcome or result of those kind of things. It's important to recognize, I think, that the approach that we're discussing today is pretty broad, it's pretty comprehensive, and it's not meant to be a one-size-fits-all approach. So we'll be talking about individual health risks and behaviors, organizational level practices and programs and policies, and culture and climate elements that we're using in the program. That might not all be practical and feasible for every employer to collect. So I think the key takeaway message in assessment, generally speaking, is that regardless of what you collect in terms of background information and data, you should be collecting as much as you possibly can, and what you collect you should be using to drive the decision-making process that you have and how you structure your program, how you implement your program, and how you evaluate your program. And so if you are limited in the data that you either have available or the ability for you to collect new information, a general good rule of thumb is to get a handle as broadly as possible on the workforce's needs and interests. Another key issue employers consistently rate as a barrier or a challenge within the implementation of their programs is how to get high levels of engagement among employees and high levels of participation. One thing that can tilt that balance in the favor of higher levels is to provide something in terms of programming or activity that is both something needed by the organization and the employees, but also of high interest for them. So that's one general rule of thumb to help you think about this. Before we get into the specific tools, let me just put everything together in this last final slide here. If you are building a comprehensive program, there are assessment opportunities throughout all levels of the organization. So from the individual employee level to the work group level or the employees, supervisor, manager level, to the broader work environment, throughout the whole organization or even into the community, there are things that can inform, again, your design and implementation and evaluation that you might want to collect data on throughout the process. This slide represents those different levels and also talks about some of the broad-based kind of indicator categories. So specifically for the NHWP, we had 3 instruments that we use to collect information from participants on, either employee participants or as the organization as a whole. And we'll go through 3 of the 4 today. The last one, part of our baseline and follow-up assessment processes, includes biometric screening. We won't be talking about that much today, but that was part of our overall process. At the organizational level, we're utilizing the CDC Worksite Health ScoreCard. This was originally released in August of 2012, and we plan on re-releasing it in the spring of next year, kind of a version 2.0 that is going to do a couple of upgrades for the current edition. That first is to add a couple additional health topic modules to what is already present in the tool, and the second is to take a paper pencil version of this tool and automate it by offering it as an online application. The online application will do a couple of things. First, it'll make completion of the scorecard easier for people. They won't have to tabulate their scores. They won't have to shop it around the organization to have it completed. People can log in and complete it. It'll also provide immediate feedback to users of the system in terms of where their strengths and weaknesses are, and also allow them to benchmark against other users of the system. The current version of the scorecard has 12 modules that are all risk or health condition focused. You can see at the bottom the 4 new ones that we pilot tested and validated within the participants in the National Healthy Worksite Program, and the ones that will be released in the spring. They cover most of the chronic issues that seem to be high priority or high cost driver issues for employers. Each of the modules asks about a number of different kinds of activities, interventions or programs or practices at the organizational level. So it does not represent any individual level data collection, only things happening at the organizational level. So those would be environmental support, educational services, coaching, counseling, benefit plan design strategies, policies, things of that nature. Here's just an example of one of the specific modules. The scorecard asks for each of the questions, which represents a single intervention or strategy, if that intervention or strategy has been in place over the prior 12 months. So it's able to pick up things that might be seasonal or temporal or annual in nature. If you do things around open season, for example, when you have new plan changes and you're signing up people for plans, that's something you normally only do at one specific period of the year. So it doesn't necessarily have to be an intervention or program that you're running throughout the year. It can still be included in your overall score. All the questions are yes, no, which hopefully makes it a little bit easier for folks. All the items in the scorecard also were reviewed in terms of the level of evidence behind the effectiveness of that intervention in having a health impact. So everything in the scorecard is recommended to be done by employers. All things are good things to do, but some interventions have more evidence of effectiveness or strength of evidence behind them. And so we weighted the scores across the different interventions where a good thing to do would receive a score of a 1, and the best thing to do would receive a score of 3. So you'll see a theme with the intervention and assessment tools we're talking about today, that the information that can be gained by going through the assessment process using tools like this is not only informative of what the current state of practice is or where your gaps are, but you can use the information derived from these instruments to drive your programming going forward. So employers using the scorecard can identify not only what interventions they're doing and where they might want to focus attention in the future, but they can prioritize interventions based off of the bang for the buck that you're going to get. So, the scorecard being an organizational instrument really geared toward an individual worksite is mostly targeting employers and specifically those people within worksites that manage or implement wellness programs, so occupational health nurses, wellness coordinators, human resource managers. We recommend that the scorecard be completed by all people within an organization that have knowledge of the diversity of health and safety interventions and activities going on. And in many times, that kind of group exercise can be a first step toward finding out integration points or finding synergies to make your existing program more comprehensive and better integrated throughout the organization. We also recommend it for traditional public health partners that we have, like health departments, our nonprofit coalitions. Many times those organizations have expertise, have tools and resources of their own that can help support employers taking action within their work sites on wellness activities. So they are good resources and they can leverage and build off of things like the Worksite Health ScoreCard in working in their localities with employers. At this point, I'm going to turn over to Brenda Schmidt, and she's going to walk you through the two individual assessment instruments that we have with the National Healthy Worksite Program.
Thanks, Jason. So all employers participating in the NHWP completed the CDC Health ScoreCard, including the 4 additional modules, and then over 6,000 employees completed 2 assessments developed for National Healthy Worksite Program. The first we called Inputs, which is the Health and Safety Climate Survey, and the other is called Capture, which is the Employee Health Assessment. Both of these surveys are available on the National Healthy Worksite Program web portal that we'll show at the end of the webinar. So these are public domain tools. And then what Veridian developed to support NHWP was actually individual and aggregate reporting that synthesized these instruments to help both employees and employers identify actionable steps that they can take to improve the focus priority areas identified once they completed the surveys. So next slide, please. So for Capture, this was the health risk assessment that we developed, and it was developed by CDC subject matter experts by each domain. So when we look at the questions specific to mental health or nutrition or lifestyle, we engage those subject matter experts in the decision-making around the best way to answer those questions. And actually, we developed a lifestyle algorithm associated with nutrition and physical activity, where in the risk scoring, it actually looked at an aggregate score of those lifestyle habits to create one risk factor. So they do follow the U.S. Preventative Services Task Force recommendations. That was something that we noticed in some other audits of health risk assessments that we looked at, is that there may have been recommendations that were either added or omitted that did not align with current recommendations. The question said it was really important that these were going to be public domain tools, that we used comparative data that organizations could use that were readily available, both on a national average and also for a local community or county. So the question set is based on the Brief Risk Factor Surveillance System, or BRFSS, and also NHANES, the National Health and Nutrition Examination questions. So that way, employers that administer these survey tools will have a comparative database. It does comply with the NCQA HRA certification requirements. for health risk assessments. And then each employee who completes the capture instrument receives an individual report, and we'll show specifics of that moving forward. And then capture inputs and the CDC scorecard are all synthesized to create an employer aggregate report that identifies focused priority areas both in health and safety and recommends the most evidence-based interventions based on the CDC scorecard, and we'll show examples of that as well. Next slide, please. These are the different domains for the capture health assessment. The health assessment does have 90 total questions. There are certainly some skip questions. 60 of those are directly related to health risk factors. About 25 are needs and interests, and another 10 or so are readiness to change. It also evaluates absenteeism and productivity questions and asks about work-related health history that addresses energy and resistance. The mental well-being area was a particular focus, and we set it up so that, employees that indicated that they had one or more days of depressed symptoms would actually trigger a PHQ-9 depression survey. And I think employers, in looking at the aggregate report, were surprised at the prevalence of mental health issues around sleep, depression, stress, and really the need to address those in the worksite. And I know that that's a prevalent topic in worksite health communities now, and looking at how to address those in the worksite. So the HRA really combines the traditional health risk assessment elements with needs and interests, readiness to change that informs program planning for employers. Next slide. This is a view of the capture individual report. It's really designed to take action. So every section, whether it's the health summary or by individual domain that line up with the CDC scorecard domains, we identify areas that need immediate attention, and those are called take action, the improve on, and then doing well. And we did a lot of market research around the graphics, the literacy, and the readability of the individual report. So you can see by the graphic that it's got a gauge, it has colors, it has labels, and it has a face, because what we found when we did market research was that different people responded differently to graphic representation of those things. And then what we really designed it was to get to action. So as opposed to saying improve nutrition, we gave very specific examples of what that individual could do to improve those different segments. So even among a wide variety of employees, we had some senior leaders that would look at it and say, yeah, it's sort of whimsical, but I get it. And so we really, I think, felt that we could, this individual report was applicable to a wide range of employees and how different employees process information. Next slide. This is an indication of blood pressure, and the way that each individual section is formatted is, it's basically, you told us this, so your health screening results were, and it would label exactly what their blood pressure would be, and that you told us that you have high blood pressure and that you were being treated for high blood pressure. So we were recognizing then in the little box around what to do is that recognizing that they had high blood pressure, confirming and trying to put some motivational interviewing in here that they were doing a good job of controlling it, but giving them very specific suggestions in this what to do box that really was formatted as a checklist so that they could actually pick the different interventions that they may want to do to move forward to continue to maintain or improve their health. And then every section has a learn more that links to additional tools and resources and educational materials associated with that particular topic. So the overall capture individual report has 3 pages of high-level focused priority areas and take action and improve on areas for the employee. But then it is about a 25-page complete report that goes through very specifically each domain area based on both the biometric screening results and the responses to the health risk assessment. Next slide. Lessons learned from administering the health assessment. We did administer this all on paper and pencil because of some of the limitations for the contract, which had its advantages and disadvantages. The advantages were we have a complete data set of people that did the biometric screening, both the health risk assessment and the health and safety climate survey. But however, it did take much longer than in filling out a bubble form and reading the instructions and doing it via paper and pencil. But we were very happy that we have a matched data set of over 6,000 people. The other lesson learned was that since we use the BRFSS as a normative comparative database, some of the questions that are asked via telephone survey are not directly translatable to a paper and pencil survey. So there was some confusion associated with some of the questions around physical activity and alcohol when we use the exact wording associated with those assessment tools. Smaller employers had greater participation. We had some small employers that had, 100% of participation, and we saw a decline in participation based on employer size. There was definitely a direct relation to the largest employers having the least participation. And really what we saw was that when the leadership of the organization supported the program and got out there and had the opportunity to talk to the employees about the importance of completing this, both for their own health and for the organizational performance, people were much more likely to participate. And in those larger employers, it was, I think, more difficult to spread the word and have that personal touch and engagement from senior leadership. Employees definitely indicated that the assessment was long. And again, I think getting it online, again, the second time around when we do the reassessment, actually having them be more familiar with the question set will most likely improve that. Next slide. Inputs is the health and safety culture audit. It is an employee perception of the employer support for a worksite culture of health and safety. So Veridian partnered with the Center for Promotion of Health in the New England Workplace, or CPH-NEW, which is a NIOSH Center of Excellence for Total Worker Health. And they have done a lot of research in the area of worksite health and safety culture with validated tools that have been used in research. So we took the wide body of questions that were available and we distilled it down to a discrete set of questions that were validated that we could start to look at some of the issues around health and safety climate, physical job demands, work-family conflict, workplace safety, and really look at how the employer or workplace environment impacted improvements in individual health. So it really was a bridging assessment between the CDC Worksite Health ScoreCard of what interventions are in place, employee health, which is individual behavior, and how is the workplace actually impacting individual health and health behaviors. And the other thing that I think was a little bit unique when we developed this is we did look at the discrepancy analysis between responses from managers and responses from non-managers. And the literature shows that the greater the discrepancy between responses and managers and non-managers is actually directly correlated with injury rates. So this did not result in an individual report back to the employee, but informed the aggregate report in focused priority areas for safety and a health climate to the employer. Next slide. These were the different areas of the culture audit. And again, this survey tool and actually the user guide associated with it are posted on the NHWP website. And these are the different types of questions and domains. In that user guide, it also cites the evidence and the source behind all of the questions that we asked for the safety questions. We were concerned as we were asking pretty sensitive questions around the workplace and management support that there would be employees that would be hesitant to answer these questions. And we did find that that was not the case, that employees were, actually we had a couple people say that they were very pleased that we were asking this type of question. And although it was made very clear that these questions were optional, we did not have pushback or a significant number of employees that did not want to answer the questions. Next slide. These are the lessons learned. The employees were willing to answer questions about their work environment. They were very interested in the culture audit results. And that's something we're going to get to in the lesson learned is definitely for both the overall aggregate health risks and culture findings, employees were very interested in the aggregate reports and in how those did lead to health improvement planning. health protection or safety and health promotion or wellness are really important to link in an overall health improvement plan. We are very much focusing on organizational improvements and interventions, including policy and environmental supports. The literature very much supports that if employees perceive that their employer is creating a health, safe work environment, individuals are more likely to take a responsibility for their health. And so we really are focusing on both of those aspects as we develop the health improvement planning in these employers, that they're not only just saying or implementing individual assessment, individual interventions such as coaching or classes and things like that, but also that we're assisting the employers in selecting evidence-based interventions at the workplace that create a healthy, safe work environment. The capture assessment and the inputs assessment were delivered at the same time. Completion times when we did it in here with folks that may have had a little bit more familiarity with the question set was about 15 to 20 minutes. When we actually implemented it in the field in a paper-based survey for those that were not familiar with the question set, it took between 25 and 40 minutes. Again, we are going to put it online. We think that that will increase the response time so that people aren't bubbling in forms. And we're also looking at how we can create derivatives of this that are perhaps shorter and resolve some of the question sets confusion associated with the BRFSS questions. Some data like depression requires additional interpretation and education facilitated by the trained staff. Those were sorts of, again, questions that employers were very alarmed at the rate of issues associated with mental health and mental well-being. It was really a great opportunity to sit down and talk to employers about how EAP is important and how they can create implement interventions that actually could address some of those stress situations at the workplace. Next slide. The NHWP employer aggregate report, again, each employer received an aggregate report that synthesized their responses to the CDC Worksite Health ScoreCard that were dynamic, as well as the aggregate results from their employees completing the capture and the input survey. It identifies focus priority areas in both health and safety, so we're making recommendations to employers about the top 3 things that they should focus on, although they're getting comprehensive information across all domains. So if there is something that they don't particularly want to focus on, that then they would could certainly pick another area. And then, it dynamically identifies the most impactful interventions from the CDC Worksite Health ScoreCard. So if we know they did 6 of 10 interventions and they have, say, tobacco is a focus priority area, the aggregate report will actually recommend the next 3 most impactful interventions from that CDC ScoreCard domain. And I'll show you examples of that as we go through it. Next slide. The NHWP Employer Aggregate Report, we wanted to provide as much information as possible to the employer. So when we collected the eligibility files from the National Healthy Worksite Program employers, we asked them for shift, their job type, all kinds of demographic, ethnicity, and language, because we really wanted to look at the different areas and whether that would be possible or even recommended to implement different interventions for different parts of their employee population. Again, as with the individual report, we very much wanted to get to action, and so the NHWP Employer Aggregate Report provides employers with very specific, actionable, evidence-based interventions that would be recommended for each topic area. There is a comprehensive resource list and glossary at the end of the report as well. Next slide. The NHWP Employer Aggregate Report does have, at a glance, high-level indicators of biometric risk and health risk compared to the reference, which was either for our purposes, the BRFSS or NHANES. Next slide. And then again, it has a little, every page has a little purple box that has a factoid about the condition and about their employee population, and then breaks it down by demographics. So either by age, by shift, by gender, and each of the focus areas was actually, these graphs were based on the data that would really be meaningful for that particular question set. Next slide. And then when we got to action, again, we have a quick fact. So it says 63% of your employees are interested in programs on healthy eating. So we pulled out a quick factoid that would be relevant to the employer. And then you can see their score on the CDC Health ScoreCard for that particular domain. And then under that, the next 3 most impactful interventions from the CDC Health ScoreCard. So it's really, breaking things out by unit that we could get, and then helps them tailor and target the programs accordingly based on the results from the readiness to change, the needs and interests, and the health risks associated with their population. Next slide. I'm just going to go briefly over some data collection tips that we went over during training for NHWP, but also really were lessons learned coming out of that. And I think that the bottom one, the stress confidentiality, would probably be the first one, is how important it is to stress the confidentiality of the individual responses to the employers. And although these are public domain tools out on the website, certainly in administering these by an employer, we would very much recommend to either make sure that they are administered in a way that protects the confidentiality of the employees completing it, or using a third party to administer it so that that confidentiality can be really stressed with employees. Objectively report the data, and I think that to Jason's point, collect information that is relevant to program planning, and don't collect data that you're not going to intend to use. Collect it as frequently as possible. In this, we didn't think we could see trends in knowledge and skill and health risk, so we're doing this annually, not any more frequently than that. Keep reports straightforward and relevant. I would definitely say also actionable. Try to marry needs of high need and interest with risk. I mean, the perfect marriage is when employees are interested in something and it also matches their need, they will be much more likely to participate. For the National Healthy Worksite Program, we didn't use any incentive for this, but definitely incentives can, I say, get people to show up. So definitely incentives associated with completing these assessments can improve the participation rates. However, we would definitely recommend that not incentivizing only completing the assessments, because then it doesn't incentivize anyone to actually follow up on the various incentives and participate throughout the year in different activities or individual interventions that the employer might offer. Next slide. And then data confidentiality. Jason and I talked about posting a guidance document and recommendations to the NHWP program website for how to administer and report on these tools to employees. So the first is to really establish procedures to protect the confidentiality and privacy of employees, and also being very cognizant of, for very small organizations, even though the assessments may be in aggregate and also de-identified, that because of the size of the organization, it may be possible to identify individual respondents. For the NHWP surveys, we did not provide detail on employee responses with fewer than 25 responses. That was sort of our guideline. And for aggregate reporting for employers that had less than or fewer than 50 employees, we actually provided the same report, but not as granular as we did for those employers that had greater than 50 employees. Again, collect the surveys anonymously. For the capture and inputs, there are guidance documents. However, you could put these in a SurveyMonkey and send them out and collect that back anonymously and create reports that can certainly guide focus priority areas from the various domains in those question sets. If you decide to do this via paper and pencil and not online, certainly providing envelopes that say personal and confidential with a central place to put those to collect the surveys, again, with clear instructions not to put their name or any other identifying information, and establishing privacy procedures to prevent breaches of personally identifiable information when administering the tools, either by survey, online survey, or by paper and pencil. We did separate out the demographic questions from the capture and input survey when we posted them on the website. When we administered them, we actually combined them, but we separated them out for the public domain tools that are now posted to the website because we felt it was really important that those demographic questions were separated so that they were not administered directly to employees if they may be administered by the employer directly. Next slide. Again, for confidentiality, limit the access to the survey data. I know in some states that are looking at mini grants and things like that to employers. They actually are requiring a third party administer the data just to maintain and make sure that that confidentiality and data protection is met. And make sure that the data are captured and stored as de-identified data. And again, any privacy during reporting of results really needs to be looked at very carefully in terms of the ability to identify individuals, even when the responses are not identified specifically to an individual. So, next slide. And I think this was just lessons learned as well, is that employees are very interested in the results from these surveys, and it really then provides a teachable moment for employees for why the employers are implementing a wellness program and how the results of these surveys link into the health improvement plan for the employer. So very much recommend that a summary, we call it a high-level employer report. We provide that to all employees to say, hey, what did we find? What was included? How many responded? When was it collected? How was it collected? Who has access to it? All of those things are very, very important to employees, and again, it continues to foster that trust between the employee and the employer as we're implementing programs. Next slide. Jason, I'm going to hand it back over to you to talk a little bit more about the training and resources for NHWP.
Okay, thank you. So yeah, now just coming down the home stretch here is where you can find all this information. So this is a screenshot of our training manual and the website direct link where you can find it. The training manual includes kind of the overview of the trainings that were delivered in terms of the core concepts and principles, links to tools and resources like these assessment instruments, as well as other templates and resource documents. So it's a good resource if you haven't seen it already. In addition, you can get video archived versions of the individual trainings that we did on the national level under the NHWP program website webinar link. As Brenda mentioned with respect to inputs, there is not only the survey instrument, but also a user manual that talks about the evidence base behind the questions and the question development, how to score the different instruments, about confidentiality, data management, administration of these types of assessment instruments. There's a similar methodology document for the CDC Worksite Health ScoreCard. It's embedded within the larger survey instrument. I believe it's on like page 42 or something like that. But you can also get it through this link here. This is a screenshot of where you can find the scorecard, capture, input, the demographic questions, the user manuals. If you go to the National Healthy Worksite Program website and go under the toolkit link, under assessment, you'll find both the organizational level and individual employee level instruments. And those are all posted live as of noon today, East Coast. So they're hot off the presses and available for anyone who wants them. These are our general health promotion wellness program websites. On the left is our broader workplace health promotion toolkit. where you can also link directly to the National Healthy Worksite Program website, or you can go to the National Healthy Worksite Program website directly. On the right-hand side for the NHWP site, you may see a column that says Program News. If not already up later today, there should be a direct link to that assessment page, which I showed on the last slide, for folks who want to go directly to the instrument. And then there's any number of ways to get on our distribution list or communicate with us or continue the dialogue about assessment or anything else going on in the world of workplace health or NHWP. Again, our two program websites. You can email us directly through our program mailbox. We've also established a LinkedIn group to continue those conversations and have those discussions. I think by virtue of your participation in the webinar today, you're probably on our constant contact list. So as we have future activities, webinars, or are releasing new information, new tools, we will send that out via the constant contact list. And here's just some references we used today, and I think we're all finished. So I guess I'll put it back to Brenda Bryan, and if we have time for a couple questions, we'll be happy to take them.
We do have time for questions, and we do have quite a few questions. So I'm just going to start at the top and read those, and Jason, you and Brenda can, whoever wants to respond to the questions can jump in. The first question is from Melinda Camaradella. Sorry if I got your name wrong. It's a tricky one to pronounce. Her question is, how do you get insurance companies on board to offer incentives and discounts? Or is this something that is paid for by the individual companies? So she's curious about getting insurance companies on board to pay for these types of programs and what recommendations you might have.
Brenda, you want to go or you want me to go?
Yeah, I would say in our experience, most health insurance companies offer a health risk assessment as part of their overall health insurance package. What we don't see necessarily is the link between that health risk assessment and health improvement planning activities associated with the employer. Employers that tend to implement a comprehensive health improvement program typically pay for that themselves and tie those more closely between the assessments that they're gathering and completing and the health improvement plan that they're developing. So incentives and things like that and actually the program costs are typically paid for by the employer.
A couple questions from Ken Germano. His first question is, he says, I may be ahead, but what specific elements were or are being employed to create participant ownership and commitment to succeed?
Can you repeat the question?
Sure. He asked what specific elements were or are being employed to create participant ownership and commitment to succeed. And by participant, I'm guessing we're talking about the employees or the end user of the tools?
Yeah, I mean, I think, and you can take a closer look at all the specific items in either the inputs or capture or the scorecard. But some of the major domains that I think get at that issue, one is around needs and interests, and we talked a bit about that in the presentation today. So if you want people to take ownership not only of their personal health, but invest in the broader wellness program that's being deployed in the work site, doing things that people like, people want, and address needs that they have is something very important. When you get into the culture and climate audit tool, looking at, again, as Brenda was mentioning, the discrepancies between what management is saying, what the workers are saying in terms of how well they're supported, what the peer support they get is, what the emotional support they get is in terms of their broader health, is a good teachable moment and learning opportunity for everyone involved in the program to target areas that either aren't well known or are misunderstood or present opportunities to integrate and invest in different types of activities.
So we're right at the end of our time. I think we'll take a few more questions. Brenda, Jason, if that's okay. If folks need to drop off, we certainly understand. So just want to thank everyone for being on the call. We'll go ahead and take a couple more questions. One from John Allen. He asked, does the Worksite Health ScoreCard account for employers with multiple locations?
Yeah, if you download the instruments, in kind of the overview and background, it discusses how a worksite is defined. And the unit of analysis for using the scorecard is really a single worksite. So a larger organization that has multiple worksites in a single community or town, or is a multinational organization with operations in different states and different countries, would be best served by administering the scorecard for each of those locations or each of those specific worksites. Now, one thing the online instrument will do is it creates users specific to an organization at both a worksite level as well as an organizational level. So policies, benefit design practices, benefits that are available to employees, more often than not, are universally applied to all workers within the organization, whether they work in different states, different countries, or what have you. So the online administration of the scorecard allows larger organizations with multiple worksites to complete the questions that might apply to all worksites equally, and then allow individual worksites who might have differences in particular program offerings or particular educational opportunities, or maybe even some local policy interventions to add that to their scorecard score and their individual worksite reports.
Thanks, Jason. There are a few questions actually around the length of the survey, so I'm going to try to just consolidate those a little bit. A couple questions around how often would you recommend participants complete the HRA once a year question, and then asking about, is there feedback on how long it is? If so, how many questions might be reasonable? A couple other questions in that similar vein, but Brenda or Jason, if one of you can just comment a little bit on the development and the length and how that might be modified for other groups.
Yeah, I don't know if we can totally answer the question today. I mean, part of NHWP's purpose as a demonstration project is really to test the effectiveness and efficiency of the different process steps or interventions that we're putting into place, particularly with small employers. So we did a baseline assessment this past summer. We will reassess people with these instruments next summer. So we're doing it on an annual basis for these kind of things. And then looking at individual instruments like the capture survey, for example, with it being 90 questions, we'll have ongoing discussions with the employer participants and our staff to determine, of that data set, what things are of most importance and relevance and utility and actionable for employers to use. So we may, at the end of the day, come out with revisions to these instruments that are more streamlined, tighter, shorter, to cut down the amount of time it takes to administer them, maybe potentially opening the door to increase the frequency in their administration. But I think largely employers and employees, in some respects, are surveyed to death. So I don't know if I would recommend doing these things, any more than 6 months to a year on a regular basis. The scorecard, may even be every, year or 2 years, although we recommend 1 year intervals on it. And I think that's something that is individual to each organization and each workforce as to what will be tolerated. And part of that, too, is then the information that's collected and aggregated, how is that reported back to the employer and the workers within that organization so that they can see that the time they took to fill out surveys is benefiting them in terms of the decisions that are being made or the programs that are being developed or the information individuals are provided directly that they can then take action on with their health coaches or their providers or other organizations in their community that they go to.
We'll do two more questions and then we'll go ahead and wrap it up. I'm just trying to consolidate some as I can. Question around processing the capture and input surveys. Is there a cost to that? And how soon are those results seen? And is it possible to supplement additional questions specific to an organization? So I'm going to let Brenda take this one maybe and talk a little bit about kind of maybe the commercialization a little bit of the product.
Right. So capture and inputs are public domain tools. Veridian has developed both the individual and the aggregate reports associated with that. And sort of related to the last question, we've actually developed a derivative of capture that's a little bit shorter. It's online, and we've actually administered that now with some commercial clients. So there would be a cost to administering the health risk assessment and developing those aggregate reports. So certainly you can contact us directly. But the turnaround time for online is immediate for the individual report, and then within a week after we have the completion of all of the employee responses. And then on paper, we typically have somewhere between 2 and 3 weeks to mail out the report. What we have done when we're mailing out individual reports is that we mail out the 3 to 5 page summary and then provide employees with a link where they can download and see and view their entire report. So that is something that we can do on behalf of organizations if that's something of interest. What other?
Let me see. One more question. I'm sorry we're not able to get through all the questions. These are great questions, and we appreciate you submitting them. A final question. Have you found the program to be effective for multi-site or decentralized organizations? There's a couple questions around that, actually, so that might be a good one to close with. I don't know, Jason or Brenda, which one do you want to take that one?
Well, the way the program was structured to be principally focused on small and mid-sized organizations, the vast majority, probably 90-plus employers that are in the program are single location operations. So we do have a couple that have multiple branches or operations in their community. They're looking at NHWP as kind of a pilot in the site that's directly participating and seeing what lessons can be applied or how things can be scaled up or rolled out to other operations within their organization. We have another one of our large employers who actually has multiple divisions within that organization who are all program participant test sites, if you will. So again, I think it's a little too soon for us to tell exactly how it gets replicated in different sites for organizations that have multiple ones, but we'll have some information on a handful of the participants who are looking at multiple work sites.
All right. Well, thank you everybody for taking the time to be on the call, and we appreciate your time and hope you have a great holiday. So we'll go ahead and wrap it up now, and thanks again.
Thank you.
Thank you.